Doesn't matter if you think the COVID virus is a Chinese conspiracy, just the flu, or a plot to mask us for life. If you need a hospital bed in Colorado for any reason, COVID is now your problem. Our Steve Stager's hearing from families with some really sick relatives still having trouble getting admitted to crowded hospitals.
She cannot move, she can't walk, she's in a wheelchair.
Are we done now?
The last week has been hell for Jim Bonde's wife, Carolyn.
Well, here's what I took today.
She's a stage 4 colon cancer patient undergoing a rough form of chemotherapy. That chemo has thrown her for a loop.
Right now, she's got no food in her for the last 48 hours, and she's gotten progressively weaker.
Jim wants to get Carolyn admitted to the hospital to get nutrition started and get her condition stabilized. He says her oncologist agreed, but Jim says the oncologist wasn't able to get her directly admitted. Instead, they went to the ER this morning, where Jim says it took about 3 hours just to get her into a room inside the emergency department.
And I understand that COVID is out there, and I understand that COVID has a huge impact. What I don't understand is how the unvaccinated people that are primarily packing the hospital system to an overflow status seem to have a priority.
SCL Health told us that, like all hospitals, they're experiencing an increased number of patients due to COVID and trauma, though they said that they do have inpatient bed space available. And they say because of that added stress on the hospital, wait times in the ER can vary.
This morning she was crying.
Jim says he and his wife are having trouble squaring the number of beds filled with people who chose not to get vaccinated with his wife's pressing need.
I don't have a whole lot of empathy or compassion for people now that are packing these rooms. There's a number of people that don't want to believe in science. They want to believe in their own science. And I don't have any use for that.
SCL also says that they have a surge plan ready to go if capacity ever becomes a problem and they need to do it. But again, they don't tell me that they have, they tell me that they do have inpatient bed space available at Good Samaritan right now. And to be clear, while all emergency departments remain quite busy right now, they are never so busy that you shouldn't go to one if you're having an emergency.
Yes.
It's just something to keep in mind.
Yeah, somebody out there being a good-hearted person is thinking, well, maybe I don't need to go, I'll save the bed for somebody else. No. Let the doctors make that call. We saw how that happened like during the lockdowns of the pandemic. People were afraid to go to the hospitals and they were dying needlessly of heart attacks and strokes.
By all means, they will get you in if it is an emergency, and they'll figure out if they need to expand capacity. But like I said, Good Samaritan said today, they do have inpatient beds that are available. They're just a little stressed, like every emergency department is, with so much trauma and so much COVID.
Yeah, you just hate to see that stress passed along to families that are in tough spots. Yeah. Thank you, Steve.